So I'm Sergeant Dan Nelson. I'm with the Seattle Police Department. I am the department's Crisis Intervention Coordinator.
And my name is Meredith Hitchcock. I am 1/3 of the Seattle Fellowship Team with Code for America.
Currently, our jails and prisons are the biggest provider of mental health services in the country. Policy changes and reduced funding into our mental health service system is the primary reason for this. Now, police officers find themselves in a role where they're often the first people responding to incidents involving people in behavioral crisis. Like most cities, Seattle handles a large number of calls with persons in behavioral crisis. We started tracking this data in May of 2015, and we're averaging out at about 25 contacts a day. A lot of the time, officers have very limited information to derive their decision-making from. Sometimes the only options are jail or the emergency rooms, and this is an ineffective use of resources. Seattle has been on the forefront of crisis intervention since about 1998. It's when we formalized our crisis intervention program and started delivering training to officers in the field. We started writing tailored action plans on how we can better serve these people who are experiencing behavioral crisis back in 2011. What we saw was because we were delivering a specific skill set and specific actions for people's individual needs, we actually showed a reduction in recidivism and utilizing the previous system. So this is a copy of a picture of what our data template looks like. Like I said, we launched it in May of 2015. Officers are required to fill this out after each contact with somebody in behavioral crisis. Some of the data collected includes behaviors that were displayed during the incident and the overall outcome of the call. The Seattle Police Department, unfortunately, is the only agency in the country who's collecting data around this contacts with people with mental health issues at this level. The Crisis Response Unit follows up on those incidents involving the most acute levels of crisis. These include incidents involving likelihood of serious harm and escalating behaviors and patterns that we're seeing emerge. For the most acute cases, the Crisis Response Team will write those specific incident action plans. These include background information on past behaviors that we're seeing in the field, current social supports, tips for how to interact with the person's displayed behavior, and suggestions on what we should do as far as disposition for these incidents. Here's what they look like. So previously these plans were shared in just email blasts. We'd spam the department. So if you were working in an area and you knew a person in a plan or this person lived in your neighborhood, you would print out the plan and just keep it in your patrol kit, and then you could refer to it throughout your shift. This had some limitations. Obviously, having it accessible. If it's in your car, it's not with you inside the residence. You couldn't search for the plans. There was no way to give immediate feedback to the Crisis Response Unit if you're learning information as a result of your call. The goal is to create a system more like this. This new app gives officers a tool to more easily connect people with the most appropriate social service system.
So Sergeant Nelson and his team were doing great work writing these response plans. And we wanted to make sure that all officers had this information that they need on the scene. With the current system, if an officer wanted to pull up a response plan, they would need to first know that the person on the 911 call had a plan, then search through their email, then click on a link, then open and read a PDF. And this is all while driving a car. So we thought we could improve on that. We did research with over 70 officers this year, which is about 10% of Seattle patrol officers. They tested the app in the field and gave us feedback on our early designs. To understand the community, we talked to people who have mental illnesses who have also interacted with the police. We also talked to case managers and other service providers like the National Alliance on Mental Illness. And here's our solution. It's called Ride Along Response, and it's an app that's optimized for patrol cars. There are two ways someone can be included in the app. They have a response plan, or they have more than 7 crisis calls. So if a person has more than 7 crisis calls in a year, the app creates a core profile. And this core profile has background information from that mental health form that Dan was talking about earlier. It gives officers more context about the person's general mental health and behaviors. And now the response plans are built on top of the core profiles. So they have tailored action plans and contact information for the person's case manager. So now officers know who to contact and what social services work best for the person. The plans also include suggestions for how to talk to the person and calm them down, and ways to establish rapport. Finally, we're tapping into individual officer knowledge. If an officer has feedback, or they know someone really well, they can just send a suggestion directly through the app. The plans are linked to the 911 dispatch system, so they're more readily available in patrol cars. If an officer has identifying information, they can just check the system while they're on the way to a call. In other words, the plans now are built into part of their existing workflow. And we know that having a better system for responding to crisis calls is essential.
So the average person who happens across the Seattle Police Department as a result of crisis incidents generates about 1.7 crisis-related calls per year. Those folks that either have a detailed response plan or a co-profile are responsible for 6.7 responses per year or 11.5 respectively. As you can see, the app handles the kind of high consumers of that subgroup. Even with just field testing, we've had some early success indicators. Here's a quote from one officer in the West Precinct about how they diverted a Seattle resident away from jail or the hospital by utilizing this technology. With the introduction of ride-along response, we're able to offer better health outcomes for people and better response options for officers in the field. Thank you.